So the next thing that plays a huge role in your lifestyle is, of course, the exercise you get, how much, how often, and what type. So that's another thing we want to talk about. So if you're somebody who's regularly exercising 30 to 60 minutes a day, 5 to 6 days a week, that's excellent. That's really excellent for all kinds of chronic pain and tension headaches included. That really seems to help in the pain modulation. So yeah, that's something that would really help. It should increase your improve your mood, lower stress, and when stress is lowered, of course, that helps with tension headaches. So there are probably several different ways in which exercise would help, and it also seems to change definitely your brain chemistry or BDGNF, brain-derived neurotropic factor, that's increased after an hour of physical exercise, and the endogenous, your body makes its own painkillers, the endorphins and the endocannabinoids, they're all released as well. So this is kind of how it works. And what could you do? What kind of exercises could you do? That really is something you can come up with by yourself, because it has to be something you enjoy doing. It could be something really relaxing. It doesn't have to be something overtly vigorous, and it could be like a nature walk. It could be something really enjoy doing and would come back to on a regular basis. Yoga is really one of the very good exercises, and we'll come to that later, because it's also a mind-body exercise. It's an awareness practice if done the right way, which also combines breathing exercise, some mindfulness, along with movement and stretching. Works on posture as well. So that works really well. So if that's something you're able to do, it would be extremely good, and it can be done a few times a week. So really, any of those exercises are good. And in terms of the yoga, there's really a randomized control trial actually comparing people who did yoga versus those who just got more education on their headaches with some handouts. Those who were doing yoga did a lot better, of course. Again, it just has to do with how it really improves your posture. It stretches out those contracted muscles. It lowers stress. And again, it's also mindfulness practice, which produces a relaxation response. So there's several different ways in which it works. So that would be great. Tai Chi is another one that's really good. So even twice a week, there's evidence if you're doing it twice a week, but you have to do it for 3 to 4 months to see the difference. We can really lower your pain levels, improve energy levels, and quality of life. Ultimately, the goal is you need less rescue medications. So that's something that would help you achieve that. So breathing exercises go a long way, and breathing exercises are not really difficult to do. They can be done sitting in a chair. It's kind of like chair yoga. But breathing exercises, there's evidence they work on, again, the pain pathways, seem to modulate pain in interesting ways. They're mindfulness practices as well, which again have evidence for all kinds of chronic pain syndromes and headaches particularly. So this diaphragmatic breathing, that one is where you would just keep one hand on your stomach, and the hand on your stomach has to go up before the hand on your chest. So that's how you know you're actually engaging your diaphragm in the breathing practice. So that's diaphragmatic breathing. You're taking deeper, fuller breaths with diaphragmatic breathing. The other one is alternate nostril breathing. I really like doing that even in bed. At times I can't go to sleep. It's a really nice practice to do at bedtime. So that's like easy to do. You just use your thumb and your ring finger. So you take the breath through one nostril, release to the other. As simple as that, and it can be done for a few minutes just right before bedtime. That's a great one. There's also other breathing practices which I could put the link for, that you can do, and they're really helpful as well, and certainly have absolutely zero side effects, but yet they can particularly help depending on whether you're interested in doing, and if that's something you can regularly do for a few minutes at bedtime. Acupuncture is another really interesting modality that can help people heal their headaches significantly. And there is evidence for acupuncture based on a randomized control trial with 270 patients, and they did it for 12 weeks. And they had 12 acupuncture sessions, I'm sorry, over 8 weeks, not 12 weeks, and it showed significant benefit. We don't have that many studies, and some studies are poor quality, but NIH studies do seem to show good evidence for acupuncture for tension headaches. Again, it seems to affect pain modulation, seems to affect the nervous system, and the chemicals produced in the muscles seems to help your body get back into healing itself, which is just kind of giving that extra nudge to help heal itself. So it's a great way of doing it. One of the things along the lines of acupuncture I would like to mention is acupressure is like acupuncture, where you kind of put some pressure on those pressure points. And the marma points in Ayurveda are even older than acupressure. That's how acupuncture came to about 2,000 years ago, but marma was almost like 5,000 years ago. It's the same concept as using acupressure. We just use those same points and we put pressure on them. So that's something you can easily do at home. And I would like to show one of the marma points today, which is for the tension headaches particularly. So that is something you'll find at the base of your neck. So, right here where you're right here at the neck, and then you take your 4 fingers, run it along the sides of the neck. When you get to the base of the neck, keep it right there and take all the fingers off except for the middle finger. So, and then with the middle finger you can just apply some pressure there, and then after that you can resume massaging that area. That will help release some of the tension, but do it on both sides. Again, like same thing on the other side with 4 fingers, and then take off the other fingers, apply gentle pressure with the middle finger. You'll feel some of the discomfort there, especially if you're somebody who suffers with tension headaches. Those are the marma points. It's called the Amsa marma in Ayurveda for stress, and a lot of people carry stress over there and unresolved emotions and conflicts. So that's a place of letting go, releasing some of the stress. So that's a simple massage practice you can do before bedtime, each side. Again, you can combine it with breathing. At exhalation, you can press down and then release. So you can combine it with a simple breathing exercise. So that's a simple acupressure practice you can do at home. With physical therapy too, there's evidence, and some physical therapists really work with patients with tension headaches well. So if that's something that you can do, that would be really beneficial. But the movement is great, and some of the simple movements you can do at home, kind of stretching out the neck muscles based on your level of range of motion and comfort, is starting with just simple, rotation. So turning your neck, to either side, and then just up and down, lifting and then stretching it to both sides. So, but that's just some of this basic stretching moves that you can do, and can really reduce the tension in the muscles. There's also manual modalities, which is like osteopathic manipulative movements, manipulative treatment, and there's also massage and chiropractic manipulations, all of which have been proven to be effective for tension headaches and seem to reduce the headache rescue medication requirement and improve quality of life. So certainly something that could be very beneficial is the manual medicine. Again, the other aspect is the MBSR, or mindfulness-based stress reduction, which is something we kind of spoke about a little bit. It's like the physiological response you get with meditation and mindfulness practices, which a lot of them that we spoke about share. And the effect can be really long-lasting. But to add to the ones we talked about, meditation is one. Breathing exercise is a great way of meditating, in my opinion, because it's a mind-body practice. You're bringing awareness to your body. That's a great way of meditating. But you can also do guided meditation, guided imagery, and biofeedback, which are all excellent. They're really great. And Kaiser actually has free guided imagery that anybody can use, that you can just click on and listen to for different issues such as headaches and stress. They're all really beneficial, even a few minutes, and there are so many apps as well that kind of help support that. And again, bedtime is a good time to create that kind of ritual and help your body into healing. So, because your body has the ability to heal, and these are all different options you have to help your body get there. Because as we spoke about earlier, with conventional medicine, we can't completely heal your body. We can help you cope better with some of the symptoms. We can't help you heal your body, but healing comes from within. So that's something you have to, carve out your healing yourself, and you have to get your body to the right place of healing by trying multiple different things. So I hope this was helpful.